basically what the African Medicines Agency is going to do is to take on the work that is currently being undertaken under the AMRH initiative, which has been supported heavily by partners, including World Health Organization, the Gates Foundation, the World Bank, the US government, and quite a number of other partners.
Building the capacity and making sure the links are there, and that the processes, in fact, are more streamlined. So reliance, joint work sharing, joint assessment, inspections, etc. And we would, if anything, expect that this would accelerate with the implementation of the AMAs.
None of us have the full range of technical skills that we require as regulators. But if you look at us as a continent, as a group of 55 member states, I think on the continent we have those skills.
One of the challenges certainly is a certain level of complexity. I think there's the complexity of the African continent going from national to regional to continental. And then the complexity of also embedding this continental exercise into a global network.
So I think IFPMA that has also that platform that there could be sharing of information and work would be something that you could see it's a success.
IFPMA is the vision. Let us not forget that. And as patients in Africa, my members, we are absolutely committed to this, and we want to drive this forward.
They learned relatively quickly that just looking at the clinical data and just looking at the cost effectiveness of approval of a therapy was not good enough. It didn't answer all the questions. There were many questions that could only be answered by patients.
Working in public health has one damned very peculiar feature. No matter how good you are, you always should be better.
Listening to patients at hearings on products was incredibly powerful, incredibly powerful. So I think in terms of improving decision-making, the patient voice is really vital.
There's clearly a consensus that we need to continue this movement that's going on. There is a role for various organizations to help develop a platform, develop the guidelines and bring the patient groups together, and particularly in resource-limited settings.